I'm Steve Edwards. I'm honored to serve as President and CEO of Cox Health. Today's February 8th, and we want to provide an additional update both for our staff and for the community about the status of this disease. We want to talk a little bit about the variants and the new strains that we're learning about, an important update on vaccines, the allocation and distribution of those, and also a little bit of discussion about the future, where we think this pandemic's headed and how we can gradually find a new normal. So today, as I woke up, we had 71 COVID positive patients in the hospital. This is a nice easing of volumes. We were as high as 170 3 weeks ago. And so this is a nice, consistent reduction of patients. We've also seen lower infections in the community as well. So that's encouraging. Year to date, we've had over 3,100 COVID positive admissions. Sadly, we've lost over 400 patients to this disease. We're also grateful that we have the capacity, the staff, the PPE, the equipment to take care of more patients if we do have a second surge coming our way. We're hopeful that doesn't happen, but we want to be prepared. It's also a reminder that we know that there have been many patients been reluctant to seek care, have been deferring care for other conditions, and so we want to encourage you that it's a nice time. If you want to seek care, please, the hospitals have capacity, and we worry that the longer people wait, the more acute their cases become. We also want to spend some time talking about why did we have this surge and why is it low? And we don't know the answers for sure. We can only speculate, but I believe it has to do with exposures. Anytime you have an infectious disease, it spreads based on exposure. So what would have happened in November, December, January time for more exposure? So we think the holiday activities probably did drive a lot of that. And so now we've had that wave and now it's calmed down. And then we look what could cause more exposures in the future. So we're looking at what could happen the next 2 to 10 weeks. We know that, for example, in Springfield, our largest school district in the state, has become fully seated again. There's really good data that shows that you can do that safely. We know that there's consequences for patients or students not being in school as well. We've got to weigh those out. One of the things we're sensitive to, though, is that the data that shows you can do that safely is focused on very stringent mitigation practices. So we encourage schools to make sure that you have physical distance, you have mask wearing, properly mask wearing. Many schools are doing smart things to keep their hallways less crowded by having students discharge at different times from their classes or go in a common direction, making sure students aren't eating, facing each other unmasked. So those things are important. We'll monitor those trends and see what happens in the next 10, maybe 2 to 10 weeks if that causes more infections in our community, because as students get infected, they can asymptomatically bring it home to their parents, who then bring it to work, and then we see maybe 2 to 8 weeks later more infections in our community. Let's talk a bit about variants. And so you've begun to hear about these new variants. There's the Brazilian variant, there's a United Kingdom variant, and there's a South African variant. The South African variant is worrisome because it does seem to be fairly agile about ducking vaccines, and so we're worried about it. The Brazilian variant seems to show reinfections for people, so people getting it more than once. And the UK strain, the B117 strain, which we identified in Missouri this weekend in Marion County, it's here. It is highly infectious, probably 30 to 56% more infectious than the original strain of COVID. And what this probably means is that this is more likely caught through airborne transmission. And so that means that masks are probably less helpful because it's encapsulated droplets that a mask prevents. And so airborne could mean there's a higher risk of getting it just by walking around in a store or in a classroom, etc. So if that's the case, it probably makes sense to be even more careful with masking. Some people are wearing 2 masks. There's no science behind 2 masks, but intuitively kind of makes sense that might help for another barrier. I look at it like a lap seat belt and a shoulder seat belt provides you more safety, so that's important as well. The vaccine data is coming out, and we want to talk about that a little bit. So J&J is now applying to be a vaccine to the CDC. Their data looks to be less effective than Pfizer and Moderna, but it's also very important to note that J&J was specifically put into a trial in areas with more variants. And so with more variants, it's likely to be less effective. Its data shows about 55% effective in South Africa, about 72% effective in the United States. That may be directly related to the number of variants. But here's what's encouraging about the J&J data is after 28 days, it appears to be stopping about 85% of all the associated hospitalizations and mortality, and at 49 days, 100%. So it may be that this new variant could still get people sick, but with the vaccines, it might reduce the risk of hospitalization by as much as 100%. Vaccine seems to grow more effective over time. We use Pfizer and Moderna in the United States right now. Cox Health has been administering Moderna vaccine. Missouri is getting about 40,000 Moderna vaccines a week and about 40,000 Pfizer vaccine a week. Because they require 2 dosing, a primer and a booster, that really means we're getting the equivalent of 40,000 people fully vaccinated a month. And why is this important? Because we have about 6.1 million Missourians, and if we're only getting about 40,000 doses a week, that means we're on a journey that's 2 to 3 years long to get people vaccinated. Now, I don't believe that's what will happen, because I believe production will increase, and I believe other vaccines will come in the market, like J&J, likely maybe as soon as sometime in March. But that's a reminder why hospitals are being very stringent about segmenting who gets a vaccine. We know that mortality is directly correlated with age, almost directly correlated with age and obesity and other comorbidities. So at Cox in particular, we're very much focused on the state's guidelines to focus on the ethic that who is most at risk to die is who we vaccinate first. You can see on this slide where we are in that list. We're now in the 75 plus age group with a significant comorbidity. We'll keep working our way down from that. It's interesting to understand maybe how Moderna gives you protection. From day 1 to day 28, on average, you have about 50% protection. But the reality is it probably takes about 9 days to get some protection. So the placebo and the vaccine groups start to split at 9 days. And we think beyond that period, it grows in protection up to about 80, maybe even 90% by the time you hit day 28. That's the time for your booster. Once you get the booster, the general population is about 94.5% protected, so very high levels of protection. I also think we can theorize that the booster will give us enduring protection, so think of a tetanus booster. So it's another reason why we encourage people, don't just get your primary vaccine, get the booster as well. We don't know how long it will work, but we think it will work longer, and so give us more protection. We know that at Cox Health, we've vaccinated a lot of our employees now. And to give you some perspective, in December, we were having about 15 to 20 employees become infected every day. Infected in the community, not at Cox Health, but our employees becoming infected. In February, in the first 7 days of February, we've only had 5 employees infected. So by perspective, we would have had 140 employees infected in the first week of February. We're at the same trend as December. Of course, we've started vaccinating our employees in late December, and they're beginning to get full protection from that. So that's another reminder this vaccine works. So let's talk about the future. We know that there are unanswered questions so far about these variants. I'm reminded that this may either be the beginning of the end or the end of the beginning. We're making the right progress. I hope it's the beginning of the end, but we know that there's a very strong likelihood that this disease can become endemic. Endemic meaning it will be with us. It won't be like smallpox where we wiped it out and we moved on. Maybe more like the flu or malaria or HIV, other diseases that we continue to fight. We will likely see developed countries get it under control more quickly based on vaccination rates and other mitigating practices, and developing countries may be wrestling with this for years or decades. So it will continue to be a challenge in the third world or developing countries. It's also a reminder why it's important for all of us to be vaccinated if you can safely be vaccinated based on the data. If you're young and think you're not at risk, remember that you may put others at risk. So getting everyone vaccinated up to that 70 to 80% threshold is really important. And the last thing I want to say is that we know, and it's a history of almost every pandemic, that it causes society to be split and almost torn apart. And we've seen the impact of that as we've had lots of loss, we've had economic impact, we've had political division. It's also been true in almost every pandemic that eventually it's what also brings society back together. I think we're at that point now. We have a common tool, a common weapon against this disease. It's in the vaccine. We're having very good success with it so far. We just need more of it. Cox has administered now these 20,000 doses, and these high-risk category people we've given it to. Every time we give a dose, we're reminded that person is becoming protected, and seeing the oldest in our population, most vulnerable, protected is really reassuring and gratifying for our staff. So that's the update on February 8th of where Cox Health and our community stands with COVID. Thanks for spending the time to listen to us.